Good afternoon. I'm Gena Bravo, and I'm going to be doing your assessment today.
Hi, Gina.
Can I have you state your name?
My name is Carol Demery.
And where are you?
I'm at Mercy General Hospital.
And what is the date?
Today's Monday, August 8th.
Carol is oriented to person, place, and time. She has no interruptions in her speech, no memory loss, and her hygiene is good. Right now I'm going to take her vital signs, and I'm going to do that verbally. I'm going to look for her height, her weight, her blood pressure, temperature, pulse, respiration rate, and pulse oximetry. Carol, are you having any pain?
No.
If Carol was having pain, I would ask her about the quality, the quantity, the duration, the aggravating factors, the alleviating factors, the setting of her pain. Now I'm going to document all those findings. I'm going to put on my gloves to start the assessment. Okay, Carol, I'm going to start with your head. Her head is round. I don't see any lumps, masses, bulges. It's symmetrical. Her hair distribution pattern is normal. I'm going to check your sinuses. First, your frontal sinus. Do you feel any tenderness? And then your maxillary sinus. Any tenderness?
No.
Next, I'm going to check for your lymph nodes. We're going to start at the occipital, the post-auricular, pre-auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the supraclavicular. Moving on to your eyes. Your eyes are symmetrical, they're round, there's no discoloration, no swelling, no redness. I don't see any drainage. I'm going to check your pupils. Her pupils are equal, round, and reactive to light accommodation. Next, I'm going to check your extraocular movements in the 6 cardinal positions. This is testing cranial nerves 2, 3, and 6. I'm going to have you follow my finger. And now I'm going to test confrontation or your peripheral vision. Can you go ahead and cover your eye and tell me when you see my finger?
No.
Okay, and then cover your other eye and tell me when you see my finger.
No.
Okay, and that was testing cranial nerve number 2. We're going to move now to her ears. The ears, the skin is intact. They're equal, symmetrical. I don't see any lesions on them. There's no drainage on either side. I'm going to check cranial nerve number 8, doing the whisper test. I'm going to say a sequence of letters, if you could just repeat it for me.
KB3.
Perfect. And now on the other side.
3KB.
Perfect. And now I'm going to do the Weber and Rhine test. Tell me where you hear this.
Both sides.
Okay. That was the Weber. And now we're going to do the Rhine, which talks about air conduction versus bone conduction. Tell me when you don't hear it anymore.
Now.
Tell me when you don't hear it anymore.
Now.
Perfect. And one more time. Tell me when you don't hear it anymore.
Now.
Okay. And tell me when you don't hear it anymore.
Now.
Perfect. Now we're going to move on to your nose. Her nose, there's no discoloration, no lesions, no deviation, no drainage. I'm going to have you plug up one side of your nose and go ahead and smell. This is testing cranial nerve number 1. Do you smell that?
Yes.
Okay, and then go ahead and do the other side. Cranial nerve number 1, and you smell that?
Yes.
Okay. Next, I'm going to move to her mouth and throat. If you could go ahead and open your mouth. Her lips and mucous membranes are pink and moist. I'm looking for lesions and abnormalities. I'm looking at her soft palate, her hard palate. Her uvula has nice rise. Her tonsils are equal, no exudate, and her pharynx is normal. She does not have any missing teeth. Go ahead and stick your tongue all the way out and say ah. Okay, a little bit of gag reflex in there. And that's checking cranial nerves 9 and 10. Go ahead and stick out your tongue. We're looking for protrusion and midline. Your tongue is midline. We're checking cranial nerve number 12. Okay, and now I'm going to check cranial nerve number 5 and 7. I'm going to go ahead and have you do some facial movement. So if you could go ahead and smile and frown and wrinkle your forehead and blow out your cheeks and clench your jaw. Perfect. And then the last test right here is cranial nerve number 12 again. I'm going to have you press your tongue against my finger on your cheek for resistance. Okay? And go ahead on that side. Perfect. Now I'm going to check your neck. If you could lift up a little bit. There's no bulging abnormality. The skin is intact and looks normal. I'm going to go down your trachea, which is midline, past the cricoid. I'm palpating your thyroid, which is not enlarged and there's no nodules. Go ahead, I'm going to check your steinomyoclastoid muscle and also cranial nerve number 9. And check your shoulders one more time. Okay, good job. Okay, we're going to move on to the musculoskeletal exam. I'm going to start and I'm going to look at your spine for kyphosis and lordosis. And your spine is intact and straight. Okay. Then I'm going to check each joint for range of motion. She is keeping her shirt on, so what I will be looking for, if her shirt was off, I would be looking for redness, swelling, if there was any deformity or abnormalities in the joint, and if it was warm to touch. So I'm going to have you move your neck side to side, and then up and down, and then move your jaw back and forth. Okay, and then go ahead and we'll have you rotate your shoulder. Okay, and then rotate your elbow. And then roll your wrist. Okay, and then your fingers. Okay, I'm going to have you lay on your back. And move your hip. Okay, and then your knee. And then your ankle. And your toes. Okay, then I'm going to have you sit back up. And I'm going to have you push resistance. So you're going to start with your neck muscle, so your head. So push against my hand as hard as you can. Perfect. And then hold your hands out and then push up on my hands to beat my resistance. Okay? And then with your knees, do the same. Push up on my hands as hard as you can. Okay? And then one more on your feet. Push up with your hands. Perfect. Okay? I'm going to go ahead and ask you to walk across the floor right here. Good. Have a seat. It's not ataxic, no Parkinsonians or anything like that. Have a nice steady gait. I'm going to now do your neurological exam. We're going to start off with having you tell me, and I'm just going to do this exam like the musculoskeletal on one side to tell me if this is sharp or soft. Okay, so go ahead and close your eyes.
Soft. Sharp.
Okay, I'm going to come over on this side so she can see what I'm doing.
Soft. Sharp.
Okay, on your legs.
Soft. Sharp. Soft. Sharp.
Okay, then I'm going to go ahead and have you lay back. All the way. And then your legs flat. And I'm going to have you lift one leg up right there, and then flex your foot. Do you feel any pain in your back with this?
No.
Okay, go ahead and go down. I'm gonna check your deep, go ahead and have you sit back up. I'm gonna check your deep tendon reflexes. So I'm gonna check your brachial. Okay. I'm sorry, that wasn't your brachial, that was your bicep. Your tricep. Your brachial radius. Your knee. Yeah, good reflexes. In your Achilles. Good. And then I'm going to check for the Babinski. Good, very good. Okay, now we're going to move on to the lungs. So I'm going to go behind you. First, and again, she's going to be leaving her shirt on. So I'm going to, if her shirt was off, I would go ahead and palpate and look for any lesions, any bumps, anything that was in her chest area. So I'm going to palpate your back for fremitus. So I'm going to have you say the word 99 while I touch around your lungs with the palm of my hands.
99, 99, 99, 99.
Okay, now I'm going to percuss the 6 areas on her back. Okay, I'm going to auscultate 8 areas on posteriorly and the 2 areas anteriorly. So take a deep breath. One more. One more.
Dr. Marshall, hospitalist line 2.
And one more. Okay. And then I'm going to go ahead and listen here. And here. Next, I'm going to have you stand up and check for the Bromberg. I'm going to have you stand up and put your feet together and close your eyes. And we're going to have you stay about 30 seconds. There's a clock up there. 15. Okay, go ahead. Good job, good balance. And then I'm going to go ahead and have you touch your shin, your heel of one foot to the shin, and then do your others. Okay. Okay, I'll have you go ahead and sit back down. Next, I'm going to check your heart. And the first thing I'm going to do is I'm going to palpate your chest and feel for any thrill. Okay, I'm going to go ahead and have you lay down. Okay, and I'm going to listen to your heart sounds. I'm going to start aortic, pulmonic, herbs, tricuspid, mitral, and apex. And then I'm going to listen with the bow of the diaphragm for bruits, and I'm going to hit the 4th and the 5th position. 4th and the 5th intercostal for bruits. Okay, good, very nice. Next, I'm going to go to her vascular. I'm gonna look at the legs and the arms, and I'm looking for any vasculature. I'm looking at discoloration, hair growth that isn't correct, redness, blueness, any sort of markings on the skin. I'm going to check her skin turgor. She has good skin turgor. It bounces right back to where it should. She has toenail polish on her feet. Normally, I would take that off. For this exam, I'm going to demonstrate it on her fingers. I'm going to check her cat refill, which is less than 2 seconds. I'm going to check the temperature. I'm going to check for edema. She does not have any edema. And then I'm going to check her pulses. I'm going to check, starting with her carotid. It's normal, 3+. Her brachial, normal, 3+. Her radial, normal, 3+. Her popliteal, normal, 3+. Her dorsalis pedis, normal, 3+. And her posterior tibial. And normal, 3+. Next, we're going to move on to the abdomen. So I'm going to do a skin check again. I'm going to look for, I'm going to pull down this just a little bit, sorry, thank you, sorry. I'm going to look for striae, for scars, for abnormalities, for bumps, for lesions, for anything in the skin, the inspection. I'm looking at her umbilicus. I'm going to go ahead and have you raise your head and hold your breath and check for hernia. No hernia, okay. I'm going to auscultate all 4 quadrants for bowel sounds. And then with the bell, I'm going to listen for the arteries, starting with the renal, aortic, renal, iliac, and iliac. Okay, all normal. I'm going to percuss the area in all 4 quadrants. And then I'm going to do palpation. First, I'm going to start light and then deep. Please let me know if you feel any pain. Pain. I'm going to go deeper. No pain associated with this.
No
and then
pain.
I'll go deeper. And light. And then deeper. And light. And deeper. I'm going to check for rebound tenderness, which if I go like this, that it rebounds, and there's no pain with that. For the gallbladder, I'm going to hook right underneath the ribs, and that is Murphy's sign. If she has tenderness with that, she may have a gallbladder. McBurney's side is in the lower right coordinate, and I'm going to test that for appendicitis. For the genital and rectal section, I'm just going to verbalize it. I would check her genitalia and her rectum, the whole perineal area, for any lesions. I would check for drainage. I would look at the skin, sores, wounds, anything like that. I would look in the inguinal and femoral areas for hernias, the inguinal area for the lymph system. Being a female, I would do a breast exam. If it was a male, I would go ahead and do a prostate and testicular exam. That is it. I'm going to wash my hands, and thank you.